Bum 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 bum.
Oh, hello. I didn't see you there. Well, now that you're here, why don't you have a seat and take a listen, because we're going to instruct you, the student physical therapist or the student physical therapist assistant, on how to teach a non-weight bearing patient to use bilateral crutches. This video will go over 3 scenarios so you can teach someone how to use bilateral crutches safely and appropriately. We'll go over the sit-to-stand transfer, how to ambulate on level surfaces, and how to negotiate stairs.
The first test this video will be going over is the sit-to-stand transfer. First and foremost, you should always introduce yourself to your patient and educate them on the task in which you will be performing during this therapy session. The first step to the sit-to-stand transfer is to position the crutches in the hand on the side of the non-weight-bearing leg, as you can see in this photo. Second, you are going to have the patient take their opposite hand and position it on the armrest and scoot themselves forward in the chair to position themselves at the edge. Next, you'll have them place their weight-bearing leg underneath them and closer to them in order to stand when ready. You will now position yourself on the non-weight-bearing side for safety and support while the patient is standing. Next, you'll have them lean forward in the chair, and on the count of 3, you will have them stand up. Once standing up safely, you will ask them to bring one of the crutches to the opposite side and position them both under the armpit of each arm. Your patient has now successfully performed the sit-to-stand transfer. The second test this video will be going over is ambulating on level surfaces. Now that your patient is in an upright position, remind them to maintain their non-weight bearing precautions by keeping their involved leg up and off of the ground at all times. With your patient in this standing position, you will instruct them to bring both crutches approximately 1 foot in front of their weight-bearing leg, and then push through both arms to bring their weight-bearing leg forward to match evenly with both crutches. They will repeat this task until they feel comfortable, and until they are proficient in this step 2 pattern, they can move on to a step 3 pattern where they bring their uninvolved leg through the crutches to increase speed and proficiency when ambulating. As you can see in these 2 clips, a step 2 pattern is bringing the uninvolved leg up to or even with the crutches, and a step through pattern is bringing the uninvolved leg past the crutches. Task number 3 is descending the stairs with a railing. The most important part of teaching a patient how to descend or ascend the stairs with crutches is to ask them if they have a railing at home and on what side the railing lies. Once you have determined the side in which the railing lies, you ask the patient to position the crutches on the opposite side. When positioning the crutches, they can be placed in 2 positions, as you can see in this photo. One in both hands and under the arm, or placed in a T-like position in the next photo. Once the crutches are positioned, you can instruct the patient to move themselves as close to the edge of the stair as possible. Don't forget to remind your patient about their non-weight bearing precautions by keeping their leg out in front of themselves so it does not hit the stair below nor bump into the step behind. Once the patient is positioned at the edge of the step, you will position yourself in front of the patient 1 step below them at all times as descending the stairs. Now instruct your patient to slide their hand down the railing to match with the stair below, as well as bringing the crutches down to the step below. You will now have the patient push through both hands in order to lower themselves down to the step below. They will continue these steps until the staircase is completed. Once at the bottom of the stairs, the patient can return the crutches under each arm to finish descending the stairs. Task number 4, ascending the stairs with a railing, is similar to descending in crutch position and hand position on the railing. But now you will position yourself as the therapist behind the patient, staying one step behind for safety. You will now instruct your patient to press through their hands in both the crutch and the railing to lift their uninvolved leg up to the step above. They will follow with the crutch and the hand, moving them up to match. They will continue these steps until they have reached the top of the stairs, to which they can return the crutches to under their arms for ambulation. The last 2 clips you will see are descending and ascending the stairs without a railing. Similar to with a railing, your positioning does not change. When going down the stairs, you are positioned in front, and when going up the stairs, you are positioned behind. Your instructions also do not change, except now there are 2 crutches instead of a railing. You will instruct the patient to bring the crutches down a step, press through their hands to lower themselves down while descending the stairs, and you will tell the patient to press through their hands, bringing themselves up to the stair, and then following the crutches in order to ascend the stairs. And that is how to teach a non-weight-bearing patient the use of bilateral axillary crutches. Do 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 do